Our knees are there to support us in every step we take. We go through life not even thinking about them until one day, a pop, a snap, an ouch. Or maybe it's more gradual, an occasional ache that gets worse and worse and turns into a constant pain. What was once something you never thought about suddenly becomes all you can think about. Today, we're talking to one of the country's top experts in knees, and we'll learn about the Jiffy Knee, a revolutionary new approach to knee replacement surgery that preserves soft tissue, minimizes trauma to the muscle and tendons, and has been providing patients with significantly faster recovery and less post-surgery pain. It's giving knee replacement patients an amazing recovery story. If you suffer from knee pain or love someone that does, this is an episode you don't want to miss. It's a new season of Healthy Cells, Healthy You. I'm your host, Janet Walker. I've been working in the healthcare community for over 30 years, and for 20 of those years, I've also worked as a writer and producer for the Windsor Broadcasting award-winning national PBS health information TV shows, American Health Journal, and Innovations in Medicine. We've interviewed thousands of doctors, scientists, and researchers on every topic related to health, medicine, and medical technology. You can watch current episodes of Innovations in Medicine on your local PBS channel, or you can stream our programs on the American Health Journal channel, the Better Health channel, and TV Healthy Kids. Starting this season, I'll also be a new host for Windsor's award-winning podcast, Better Wellness. Today's guest is renowned orthopedic surgeon Timothy Kavanaugh of AZ Ortho in Scottsdale, Arizona. Dr. Kavanaugh is board certified and fellowship trained, specializing in the newest surgical and non-surgical treatments for knee, shoulder, and hip pain. Dr. Kavanaugh has performed over 8,000 joint replacement surgeries and over 1,000 Jiffy Knee procedures. Welcome to the show, Dr. Kavanaugh.
Hi, Janet. Thanks for having me.
So, according to the American Academy of Orthopedic Surgeons, 700,000 total knee replacements are performed in the United States every year, which surprised me. That's a lot. So that means there's a lot of patients trying to get their mobility and quality of life back. Let's start with some basics. Knee pain is a common complaint of people of all ages. What are some of the conditions that cause knee pain that no longer responds to conservative treatments?
So there's a variety of conditions that can lead to knee pain that end up causing people to see an orthopedic surgeon. Most of those are various forms of arthritis, which osteoarthritis is the main type of arthritis out there. That is the common wear and tear arthritis that we hear about. It is something that runs in families. I tell patients that probably at least 50% of arthritis diagnoses, run in families. So there's a genetic component to it for sure. And then there's definitely a component that causes it to be accelerated from previous surgical conditions or knee injuries. Other conditions are rheumatoid arthritis, lupus arthritis, psoriatic arthritis, post-traumatic arthritis, which is when someone has a fracture, for example, that goes into a joint, such as the knee. It gets fixed and heals, but there's always damage to the cartilage when that happens, and that can really lead to arthritis down the line. Those are probably the main ones that I see in the office.
Now, you've performed thousands of total knee replacements, and it's not minor surgery. When is the right time for a patient to consider a surgical repair like total knee replacement?
That's a great question. I think that it is a answer that varies from patient to patient. I think you really have to take into account how much the knee is bothering you, how much it is slowing you down and not allowing you to live your life, whether it's just with everyday activities or recreational activities or both, and how much it's affecting your overall quality of life. And I think when you think about those aspects of it, that's when you can be confident that you're making the right decision to go ahead with knee replacement after all conservative means have been exhausted for treatment.
Let's talk about the procedure itself. Now, before we discuss Jiffy Knee, What happens during traditional total knee replacement surgery?
So I would like to take that a step further back and just talk about what happens during a knee replacement, because a lot of people have different ideas of what we actually do in there. So to start out with, what a basic knee replacement does is it removes the worn out cartilage and basically the ends of the bone and replaces it with metal and plastic. So when you look at the knee, a lot of people think we make a cut, 5 or 6 inches above the knee, 5 or 6 inches below the knee, and remove everything in between. And that's not the case. We're just taking off the ends of the bone. So probably at most like a 1/4 inch bone. And we're using all the rest of that bone to put our implants on. So that's one misconception I just wanted to start out with. It almost is a misnomer to call it a replacement. It'd be better to call it a resurfacing in a way to better understand it for everybody. So traditional knee replacement versus Jiffy Knee, what happens in a traditional, and we all know patients who have that straight anterior incision right down the front of the knee. You see it every day, and you probably have a lot of family or friends that have had it done. And I used to do it. I did over 6,000 of them that way in my 21 years of doing them. And under the skin, you go through and cut the quad tendon or the quad muscle or some combination of both in order to get into the joint. And you split it apart, you do the knee replacement, and then you sew it back up on the way out. And knowing what I know now, having done that for 21 years, and I don't do that anymore, that approach is what I'm convinced causes most of the pain and disability after surgery, because we don't see that with the Jiffy Knee. Most people, if you talk to them after traditional knee replacement surgery, would tell you that it was a pretty rough ride for the first 3 to 6 months sometimes, especially during therapy sessions. And what the Jiffy Knee procedure now works on is that first 3 to 6 months where we're not seeing the suffering and we're seeing patients do a lot better, a lot quicker, and get back to life quicker.
So then, are there different types of implants, and how do you select the right implant for each patient?
There are multiple different types of implants. The basics of any knee implant are metal and plastic, which is high density polyethylene. So the metal components are what is fixed to the bone on the end of the femur and top of the tibia. The plastic layer goes in between those two and is the bearing surface. And in most knee replacements, there's a plastic button that goes on the underside of the kneecap that replaces the arthritis there. The metal most commonly is titanium in the tibial component and an alloy of cobalt, chrome, and nickel in the femoral component. There are different variations of knee replacements that take into account different functions of the cruciate ligament. There's also different types of plastics that account for different geometries and stabilities of the knee. And there's also knee replacements, for example, for people who have metal allergies. And we can avoid using nickel, which is the common metal that people are usually allergic to. So we have a nickel-free implant that I use in some cases.
So it really is a custom procedure. No two patients are exactly alike.
That is true. Yeah, no two knees and two patients are usually alike either. There's subtle variations in the bone quality and the alignment and the soft tissue around the knee, the ligaments and tendons that can be tight in one knee and not tight in another knee, for example. So it really is kind of a unique procedure for each individual patient.
And then I've seen a lot of ads for robotic knee surgery. Do you use robotics in your practice? And is that necessary for a successful procedure?
So what that means is there are robots that are made by some of the orthopedic companies to put their implants in. And the robots help sense different alignments, different ligament tensions. And then they have a robot arm that comes in and helps the surgeon make the cuts. I don't use robotics. I've tried them all. And I never really was satisfied with any particular system. I use something called computer navigation, which is a device that we affix to the end of the femur and top of the tibia during surgery that measures the patient's alignment and helps me line up the implants that way.
Now, before you were trained in the Jiffy Knee technique, how many knee replacement procedures had you performed?
I've done over 6,000 primary total knee replacements.
That's a lot.
The traditional way. Yeah, that is a few.
And overall pretty successful then.
Knee replacement is one of the most successful procedures in all of medicine, yes. So if you look at the literature, it has right around 85% outcomes of good and excellent results.
So then now let's get to the exciting stuff. Let's talk a little bit about Jiffy Knee. Invented by Virginia orthopedic surgeon Manish Patel. And you were the first doctor outside of his own practice trained in the technique, certified in the technique. Is that correct?
That is correct.
So how did you learn about Jiffy Knee? What drew you to it, given that you've done so many successful traditional procedures?
It's a great question, and it's kind of a funny story. I did not know Dr. Patel before about March of 2023. I have been pretty active on LinkedIn for a while now, and he actually reached out to me on LinkedIn about it. And I didn't know it at the time, but we have a mutual friend, and our friend was one who told him when he decided he was going to start teaching this procedure. Our friend told him, hey, you should probably call Kavanaugh and see if he's interested, because I've always kind of been interested in this kind of stuff throughout my career, something that would benefit patient recovery. So he did. He reached out to me, and the first time he reached out, I kind of ignored it. I thought it was kind of a goofy name and didn't think it was something that, would have any significant benefit. And, so I kind of ignored it. And to his credit, about a week or two later, he reached out to me again. He said, hey, do me a favor, just look at the patient videos on my YouTube channel and then call me. And I thought, well, that's pretty confident of him. So it got my interest, and I went and looked at the videos. I couldn't believe what I saw. These patients are, 24, 48 hours out from surgery, and they're going up and down stairs. They're walking without any assistive devices, and they look very comfortable, and they're talking about not using any significant narcotics. And I'd never seen anything like this in my career. So I decided to go out and visit them. And we flew out there, and on the day I went and visited him, we did 8 of these in the OR, and I got to see what he was doing, how this technique really works in the OR with retractor placement, et cetera. And I knew right away, I'd done enough knee surgery in my career that I could do this procedure safely and reproduce it. But what really sold me was I talked to the patients that day in the surgery center, and there were 2 in particular that were coming back for their second knee, and they're both about 6 weeks out from their first knee, which is also unheard of for the most part with traditional surgery.
Quick.
And very quick. And I'll never forget this one older lady who told me, when I asked her about it, she said, "Oh, I'll tell you exactly why it's so great." And she lived in North Carolina, so she was about 2 hours away from where he is. People travel to go see him. She told me, she's like, yeah, right away when I went to PT, I was sitting in a room with a bunch of other people who had traditional surgery, and they were all hurting. And I was able to do my PT, and I wasn't hurting. And so she went up to each one of them and told them that, the reason you're hurting is because you had it the old way and I had the new way. And I thought to myself, I'm like, this lady here is telling me what I need to do. So I decided on a plane ride on the way home, I'm like, I got to do this. It's too good. And so we signed up and started doing it June 1st of 2023. And the rest is history, so to speak. I mean, we're just over 1,000 of them to date.
Wow.
And it's been pretty incredible, I got to say.
And so you're doing only Jiffy Knee procedures now for knee?
Since June 1st of last year, I have done only the Jiffy Knee technique on all of my knee patients. Yeah. It's too valuable to not do on somebody, I feel. And everybody that I've seen has benefited from it.
Explain again exactly how Jiffy Knee differs from traditional knee replacement, and is it the same muscle sparing or minimally invasive procedure that you see a lot of ads for?
Good question. So the Jiffy Knee, the incision's on the inside part of the knee, not straight in the front like traditional surgery. And I think that's where a huge advantage of it is, not having that incision right on the front, because that hinders people's recovery when we're trying to bend the knee. If you think about it, that incision right on the front of the knee as you're trying to bend it is under tension, which hurts. It's actually stretching the wound. And when you come in on the inside and bend the knee, it's actually relaxing. So that plays a role in it too. And when you come in from the side, you're able to go completely under the muscle and tendon with nothing being cut, and it slides out of the way to do the surgery. Slides back in place when we're done with no compromise on my part of anything I need to see or angles I need to measure or anything like that to put in the knee correctly. And then you have the benefit of having the entire muscle and tendon not cut. So the quad sparing, muscle sparing, minimally invasive, all those terms are very nondescript, and you don't know for sure what people do in there. I've explored all of them in my career, and nothing is like this, the Jiffy Knee. But what most of those entail are some variation of going in from the front and coming around under the skin, undermining all that, and then either minimally cutting into the muscle or going under it in a subvasous approach from the side. The difference being that the Jiffy Knee doesn't undermine any of the skin, so you don't have those big skin flaps that cause pain and swelling and bleeding underneath them too. So I think that's a major difference with the techniques.
So it is different for a patient to know for certain that they're getting the Jiffy Knee procedure. They need to go to the Jiffy Knee website and make sure that their surgeon is on the list of certified Jiffy Knee providers. Is that how someone would know for certain that they're getting the Jiffy Knee?
Yeah, that's correct. Yes, that's the only way for sure to be to know that you're getting a Jiffy Knee.
And then can any patient who's eligible for traditional knee surgery have the Jiffy Knee procedure, or are there some patients that wouldn't be candidates for it?
So in my practice, anyone who I think is a candidate for a knee replacement is a candidate for a Jiffy Knee replacement. So I'm doing it as I mentioned, since June 1st last year, I'm doing it in all my patients. I've even expanded it into my revision surgeries, so my redo patients. Part of my practice, because of what I do, it involves revision surgery, probably about 20% of it. And I felt early on that I could do the revisions through the Jiffy Knee in patients who have had previous, traditional surgery with that anterior incision. So I started doing it, and I found that I can successfully do it through the Jiffy Knee incision, and these patients benefit from not having that tendon cut, just like the primary patients do.
So there's not a patient that's not eligible for Jiffy Knee, but they would be eligible for traditional surgery. Any patient who's eligible for traditional knee replacement surgery would still be a good candidate for Jiffy Knee.
Yeah, that's correct. Basically, anybody who qualifies for a knee replacement is a Jiffy Knee candidate in my practice.
With regard to pain, mobility, and recovery after surgery, how does Jiffy Knee compare to traditional knee replacement surgery?
So what we see in the Jiffy Knee patients by not cutting into the muscle and tendon is significantly less pain right off the bat. And I think the best example of that is our narcotic use after these procedures. So traditionally, for 21 years, I'm used to giving narcotics to total knee replacement patients, sometimes up to 8-10 weeks afterwards. And so what we noticed in the Jiffy Knee patients right away is everybody gets a 1-week prescription of oxycodone to go home with. And we're seeing probably 15, max 20% of the patients asking for a second narcotic prescription.
Mm.
So significantly less narcotics being prescribed, which is great in so many ways,
Oh, that's great.
right? There's a narcotic problem in our country. Nobody wants to be on those. Nobody wants to contribute to it as a physician. And so we're doing something that by doing a procedure causes less pain and less of a need for narcotics. So we're seeing this pain be managed quite readily with a combination of Tylenol and an anti-inflammatory medication, along with some post-op steroids early on, and then an intermittent narcotic mixed in. What we're seeing with regards to rehab afterwards is the ability to participate in an active recovery really quick. We start with using a RomTech exercise bike that was designed specifically for knee rehab. We use that in almost all of our patients. It gets delivered to the house. That's a 3-week physical therapy program that you do 5 times a day on the bike. And then we go to traditional outpatient PT at 3 weeks. But we're seeing patients go for walks in the neighborhood with a cane or with nothing, that first weekend after surgery. Driving a car is usually right around 7 to 10 days. I have people playing golf, like literally going out and playing 18 holes of golf 3 weeks out. That's happened numerous times. Riding a bike outside, a couple weeks after surgery.
Wow.
Pickleball 4 or 5
That's
weeks
amazing.
out. Things that you never ever saw with traditional surgery.
Just knowing these things going into it must really help alleviate the fear factor that a lot of patients have. Just knowing that they're not going to have to be on narcotics after surgery for weeks and weeks must make people feel a lot better going into it.
I think it does. I think it gives patients a sense of confidence that what they know, whether it was something they experienced themselves on one side and decided I'm not going to have the other side done, or they saw in a friend or a relative who went through it and, thought, well, I'm not going to go through that. It's not worth it.
Mm.
They see these patients now recover with a Jiffy Knee and they think to themselves, well, okay, I can do this. And they're right. When people come in and talk to me about it and say, okay, I think I can do this procedure, I tell them you can, with confidence.
That's great.
And it's a nice thing to be able to tell the patients, that you're not going to see the suffering.
Nice. So does insurance and Medicare cover Jiffy Knee just like it would cover traditional knee surgery?
Yes, that's a very common question that I get. And as far as any insurance, including Medicare, is concerned, it is a total knee replacement. So there's no extra charges for it. There's nothing else billed extra for the procedure itself. So it is covered, just like a traditional surgery.
Now, because there are relatively few Jiffy Knee surgeons in the U.S., if a patient's not Medicare yet, are they able to apply for out-of-network provider so that they can have a Jiffy Knee procedure? Would an insurance cover that?
So what we have seen, and we're not only seeing patients local here in Arizona come in for this procedure, but we're seeing out-of-state patients who have different networks. Blue Cross Blue Shield, New Mexico, Colorado, for example. And so we're Blue Cross Blue Shield providers, and so it is covered by those insurances. We're on pretty much every plan, major insurance carrier. So we're not seeing any significant problems with that.
So I first saw a social media ad for Jiffy Knee about 6 months ago. And, the name looked a little goofy to me too. I assumed it was something kind of hokey. But then I clicked on the website and I thought, oh, this is a promising, really legitimate surgical procedure and lots of happy patient testimonials. So at that time, there were about a dozen surgeons trained throughout the country, and you, of course, being one of the first. And so when we first connected, you directed me to the Facebook patient group, which had just been formed. I joined that group, and there were about 100 patients. Now, just a few months later, there's double the original amount of surgeons that were there when I first went on the website. And that Facebook page has over 1,100 members. So, why do you think this procedure is getting such traction among doctors and patients?
That's a great question. I think that, first of all, with the surgeons, it's gaining traction because it's people who are interested in looking for a better way to do things. And that's what this comes down to for us. Changing surgical approaches for a surgeon from what you've been taught. I tell patients that the closest thing I could give an example to is like changing religions. It's something you kind of grew up with surgically. You learned on it. You do it that way because the people who are your mentors taught it to you that way, and it works, right? And even though knee replacement is a rough ride for a lot of people for a while, there's still really good long-term results, and that's why it's always the mentality has been, well, I'm going to do it this way because I know how to do it this way, and it works, and it gets good results long-term. When you have an open mind and you can assess things, and as I mentioned earlier, and throughout my career, I've always kind of kept an open mind to look for things that are better. And so many things have come and gone by the wayside too, by the way, over 22 years now, and this just happens to be one that's real. It took 21 years for me to find something like this, but here we are. If you can objectively look at this and say, yeah, this makes sense, right? I can do this. Technically, it's not going to put the patient at risk, or my skills are well in line with what I can do to accomplish this. Okay, let's go ahead and do it. And then you see these results, and that's what feeds the fire, right? This is about the patient results. Like I said, I don't get any extra money for doing this. This is just me putting this implant in differently, and then we're seeing these incredible patient results. So now fast forward to the patient side of this, and the best part about this is that this is patients telling other patients. Or it's funny, at first when I started doing this spread, okay, people would come in the office and I would tell them, okay, I have this new technique I'm going to do that's going to give you a quicker recovery, less pain and less swelling. And so I had to talk them through the entire procedure, why it's different and why it's not a risky thing. We can safely do this for them. And then we started seeing, okay, well, now I heard about Miss Smith who had one done, or Miss Jones. They're my neighbor. Okay. And I want what she had. Okay. So that started happening in the first couple months. And there's the Facebook ads and the Facebook talks you mentioned that I do a seminar about every 6 to 8 weeks on Facebook, which is a live Q&A. And
Nice.
those have gotten more and more popular. And it's a great way to connect with patients and answer questions. And I think the patients really appreciate that. But now we're starting to see like one of the funny ones that it's like that 6 degrees of separation thing. This was about 6 weeks ago. I saw a patient who said, yeah, the lady who watches our dogs when we're out of town, her husband has a friend who plays golf with another guy who had one of these things, and we heard about it through them. So literally like, 4 degrees, 5 degrees away from this patient who's sitting in front of me. And she was like, oh yeah. So I called that guy and he told me that, this is the greatest thing and I need to get one of these. And, it's nice that the patients are out there with real life experiences in it, knowing that they're getting a full knee replacement, which is what solves the problem of the arthritis, and they don't have all that suffering to go with it. It's another funny story. One of my earlier patients I had here, one of my neighbors, I did his surgery the week before the 4th of July. So end of June 2023. So he was in the first 15 patients probably. And so he had a surgery 4 days before the 4th of July. He went to a 4th of July party down the street, and he walked in and left his walker at the front door, and he was walking around mingling with everybody. And there was another doctor at the party who was an anesthesiologist who couldn't believe it, that he had just had knee replacement surgery. And the guy actually told him, you don't know what surgery you had because you couldn't have had a knee replacement.
Wow.
You wouldn't be walking around. You wouldn't be hurt. You'd be hurting a lot more. So I thought that was kind of funny that somebody else who didn't know what the patient had told him, oh, you couldn't have had a knee replacement, but we've heard that over and over again.
Well, you've definitely got a lot of happy patients on that Facebook group. And just for comparison, I joined another knee surgery Facebook group that was just like a traditional knee replacement Facebook group. And what a difference in terms of how people feel about the procedure postoperatively and what they're experiencing. And like you said, there was someone that was climbing a mountain 7 weeks past surgery, one of your patients in Arizona. And and people on the other
Hmm.
group are still
Yep.
using a walker at 7 weeks post-op. So yeah, it seems like it's a huge difference in how patients are recovering. Let's talk a little bit about post-op recovery and compare traditional surgery to Jiffy Knee. So, hospital stay, inpatient or outpatient?
Jiffy Knee is 85% outpatient, which is great. So you get to go home, you sleep in your own bed the night of surgery. There's a lot of disadvantages to being in a hospital after an elective joint replacement. First and foremost, there's infections in hospitals of various types. And, the last thing anybody wants after a clean hip or knee replacement is an infection. That's a big deal, avoiding by going home the same day. And then, just the PT recovery we have now for this, I believe, is just top notch. And it's part of what contributes to why these results are so good, by having that exercise bike at home that the patients do the program on. And it makes a big difference in postoperative pain, postoperative swelling, and just the postoperative mobility.
Nice. And some of these things we've touched upon, but I'm going to ask a few of them again. So, post-op pain medication, typically with
Mhm.
Jiffy Knee, how many days versus traditional, how many days?
So the narcotic use for post-op Jiffy Knee patients, everybody gets a week's worth of oxycodone. Most people don't use the whole prescription, and about 15% of patients ask for a second one. Whereas with traditional surgery, it's really common to still be giving narcotics to people 6 to 8 weeks out, sometimes 10 weeks out, especially around the time of PT. Now, the other medications we use to help with post-op pain, Tylenol is a staple after the Jiffy Knee, as is an anti-inflammatory, whether that's a prescription strength one, a lot of people end up using ibuprofen or Advil, Aleve. And then we do use post-operative steroids to help control swelling.
A need for assistive devices like walkers, crutches, or canes, Jiffy Knee versus traditional.
So everybody goes home from the hospital or surgery center with a walker. Some people use it for a day. Some people use it for a couple days or a week. Some people use it for 2 weeks, and then go to a cane. And there's plenty of people who go through that progression and end up using nothing, 3 or 4 days out. Some people are still on a cane at 2 weeks. It really depends on a couple things. One, the main thing is, what is the shape of the leg prior to surgery? If you have significant quad weakness, it's going to be harder to progress, obviously, because the muscle has to build back up, just like anything else in life. And then the individual swelling response after surgery. Some people we still see, even with Jiffy Knee, get a pretty significant swelling response. And that's more individualized on how your body responds to the surgery itself. We do a couple things to really kind of help prevent the swelling afterwards. And I think it's been effective. But once in a while, you still see somebody who's got some pretty significant swelling, and that just slows down the recovery a little bit. Now, with comparing that to my experience with traditional surgery, people were minimum on a walker for 2-3 weeks usually. It was extremely rare to ever see somebody who would progress that, okay, I was off my walker in a couple days and on a cane. It just, we call them unicorns because they were that rare that, we just didn't see a lot. And so we're just seeing that progression. And then the other point of data that we look at a lot and compare is at that 3-week mark, when the Jiffy Knee patients now are going to outpatient physical therapy. So that's their first contact with an objective outside observer physical therapist who has a lot of experience with rehabbing knees. And we're just hearing these reports from physical therapists around the valley that when these Jiffy Knee patients show up, we're just amazed at what kind of motion they have already, how easy it is to work with them because they don't have a ton of pain. They don't have a ton of swelling. And they're just way ahead of where a traditional 3-week post-op knee patient is. They're not having that suffering still like a lot of them are. And that's all due to not cutting into that tendon. I'm completely convinced of that.
How important is physical therapy to recovery?
So PT after knee replacement surgery is still incredibly important. At least probably 30-40% of the whole entire procedure, if you look at the whole picture. Pretty much everybody needs some strengthening after one of these because they come into the surgery with muscle that isn't quite up to strength, because you have an arthritic knee. And, the therapists also are the coaches after all this. They're looking at each individual patient and thinking about how we can maximize the result. And that's what helps everybody get the best happy results here, So therapy, as I mentioned now with this protocol using the RomTech bike is great because at home, it's doing 5 sessions a day for 3 weeks. And that's something we monitor in the office. And then we switch you over to outpatient PT and pretty much everybody has that. There's probably about, it's less than 10% of the patients who insurance doesn't cover the RomTech and they end up going right to PT. And, but that's still a great alternative, getting in with a PT right away and working with them to get the range of motion and strengthening.
How would you say that Jiffy Knee figures into the future of knee replacement surgery?
It's a great question. I think that knowing what I know and seeing how reproducible this procedure is and then what kind of results you get from it, patient after patient. And let me say that I think, in medicine, we treat patients, we don't treat robots or automobiles. So, it's individuals that we're taking care of, right? No matter what we're doing in what field of medicine. So not everybody behaves the same way with any given procedure or intervention, any medication, So, but what I think Jiffy Knee does for the entire population of knee replacement patients is it takes the bar and moves it way up for their recovery. And that's why when I tell patients, what's it going to do for them, I tell them it's going to improve, your life in a sense that, the recovery is going to be significantly better for you. And, your pain is going to be significantly less relative to what I know for 21 years doing traditional surgery. So this is a huge leap forward, I think. And I foresee in probably 5 to 7 years that this will be the dominant way to put in knee replacements. It's here to stay. It's going to keep growing. Surgeons are slow to adopt things. As I mentioned earlier, it's a big deal to change surgical approaches. But I think once more people learn about this and see the results in patients and get inspired to actually start doing it, they'll see that, quality, technical quality, good surgeons can do this reproducibly and get great results. This is going to expand. And so we're going to see this spread around the country. In some exciting news here in the Valley, we just are going to hire another surgeon in our group, an experienced joint, hip, and knee replacement surgeon to join us starting in January. He's going to join our group, and he's going to be in an office that we're going to have out west in the Sun City area, just to have another provider here who can give this procedure to patients. And I just, things are busy for me and it's great. But I also, look at it as from a patient perspective that, I don't think it's fair to wait forever for something like this, even though it's very good and I think it's worth waiting for. So in my mindset, I want to make this available to more patients. And so we're always around here going to look to expand this and get more people taken care of with it. So that's my philosophy, and that's how I want to look at it. So that's why we're adding another surgeon already, with me being 18 months into this, knowing how good it is and seeing it in the patients. So we're going to keep expanding this and offering it to more and more patients.
Oh, that is exciting news. That is really
Definitely.
exciting news.
Yeah.
What about age range? What's the youngest patient you've seen for Jiffy knee replacement, and what's the oldest?
So the age range is from 26 to 94.
Wow.
Yeah. So in my entire career, the youngest patient I ever have done a knee replacement on was 25.
Wow.
The Jiffy knee is 26. And so those are patients when you get down into the 20s and 30s who need knee replacements. Those are patients who have some congenital problem, post-traumatic problem. They had a bad fracture and it didn't heal, had a bad infection when they were young and their cartilage got destroyed, or some juvenile rheumatoid arthritis. That's another one that comes into play when you have the younger side. The oldest patient I've ever done knee replacements in is a 96-year-old lady. That was when I was up in Alaska.
Wow.
So the oldest Jiffy knee is 94. And this is a lady who, couldn't hike anymore. She used to hike every day up in Alaska, and she got to a point where her knees weren't letting her do that. So, she was healthy, and we did knee replacements in her, one at a time. And the interesting thing is that, age, especially I found around here in Arizona, there's so many healthy high 80s and 90-year-olds, so age really isn't a limiting factor. It's really your overall health condition. So it's available.
That's really a great thing to hear, that even people that are in their 80s or 90s are able to get this procedure and have some mobility and quality of life and relief from pain, even in those later years.
It is a great feeling to be able to offer it to patients. Yep.
Dr. Kavanaugh, thank you so much for being with us and educating us about total knee replacement, and especially about the Jiffy knee procedure.
Yeah, thank you.
It's such an important topic for so many Americans. And I hope I can talk to you again about this or another orthopedic issue that so many people want to learn about.
Certainly.
Listeners, you can schedule an appointment to see Dr. Kavanaugh and the other MDs at AZ Ortho in his Scottsdale, Arizona, or new West Valley office, or learn more about the Jiffy knee procedure online at azortho.com or jiffyknee.com. That's JIFFYKNEE.com. I'll have links to both websites in the show notes on the podcast website at healthycellspodcast.com. Stay tuned for more episodes in my knee replacement series featuring one of the country's leading physical therapists in knee replacement recovery. Thanks so much for listening to the Healthy Cells, Healthy You podcast with me, your host, Janet Walker. You can find us on Apple Podcasts, Google Podcasts, iHeartRadio, Spotify, or wherever you get your podcasts. Subscribe and tell your friends. We'll help you find solutions, and together, we'll build a healthier you.